evening's UCSF Virtual Alumni Program, UCSF Alumni Author Series, A Conversation with Robert Larsen. My name is Anne Hillerman, and I'm the New York Times bestselling author of the Lepore and Chi Manuelito Mystery Series. Dr. Bob and I both live in New Mexico and share an interest in good writing and interesting conversation. Before we start today's program, I would like to review a few housekeeping items with you to help with your experience. To submit a question during the presentation, please use the Q&A box. Please keep your questions brief. Given the size of the audience and the number of questions we expect, our speaker may not be able to answer everything. We hope you'll enjoy the conversation. Our author tonight, Dr. Bob Larsen, describes himself as a working class kid who grew up to become a working man's shrink. Dr. Bob attended medical school at Northwestern University, where he was smitten by the field of psychiatry, never having taken a course in psychology. He then completed a residency at UCSF, a Robert Wood Johnson Fellowship at Stanford UCSF, and a Master's in Public Health at the University of California in Berkeley. As an active physician and retired clinical professor at UCSF, his expertise is in the field of occupational and forensic psychiatry. In March 2021, he published his book, Wounded Workers: Tales from a Working Man's Shrink. We are excited to dive into the stories and experiences within the book, as well as to chat with the writer himself and learn about his journey in collecting them. So let's get to it. Welcome, Dr. Bob. We're going to turn the virtual program over to you to talk a bit about your book and your experiences and what led you to put them all together. Afterwards, we'll get to our audience questions. Thank you very much.
All right, Anne. Isn't she a sweetheart? Well, thank all of you for showing up tonight. I hope you're safe at home or working late in your office. We're here and I'm coming to you from Santa Fe, New Mexico. That's where I live now. I still have an office in Oakland where I work as a psychiatrist, but not as much as I used to. But we're having a storm tonight, so if you hear it, that's what happens this time of year in New Mexico. We get snow. I want to begin by helping all of you to understand a little bit of how one gets to become an occupational psychiatrist. I don't think anybody dreams of that as a kid. My parents, what they did for me is that they emphasized education. My mother never went to high school. She was an immigrant from Italy, and at 14, she began working. My dad was career military when he met my mom, and we were raised as working class kids outside of Chicago. I have to thank my wife for her patience and her encouragement in this project of writing a book. It's like building a barbecue with no instructions. I had a very good public school education outside of Chicago, and I went on to the University of Colorado, where doctors Goldstein and Weiss helped me become a scientist. And that involved the University of Colorado getting the first 1 million volt electron microscope in the country. And I became an electron microscopist, which led to me doing basic science research at 4 universities, including Northwestern, where I went to medical school. And there, Drs. Vysotsky, Hal was the chairman of the department, and Dr. Francois Alum talked about sex. And I thought this was pretty interesting stuff. Then I ended up in psychiatry. I came out to UCSF. There, Roland Levy was one of my professors, and he was involved as a forensic psychiatrist in the trial of Dan White, if you remember, the assassinations of Milk and Moscone. Along with that, Dr. Bernard Diamond, he was also a forensic psychiatrist. He taught, of course, mental health law. When he retired, I taught the course Psychiatry and the Law. Carol Brodsky encouraged me to start taking cases in workers' compensation when I finished up my residency. Joe Ledoux was the head of the Division of Occupational and Environmental Medicine, and he invited me to work with him, and we put on 3 national conferences entitled Work and Mental Health. So I had a lot of mentoring through my years at UCSF before I became a professor. Hal Holman at Stanford introduced me to health policy, along with Phil Lee, who they have an institute named after at UCSF. I went to Berkeley, as you heard, and I got a master's, and my thesis was on impaired physicians. Not a fun topic. But not all my teachers were doctors. There's someone on the call today, I believe, Carl Brackensack, who is a friend that I owe much to. He was the administrative director for the California Society of Industrial Medicine and Surgery, and Carl encouraged me to be an advocate, not just for individuals, but for the collective. When I got out into practice, applicant attorneys, Barry Williams, Catherine Ringo, and someone who's on the Zoom tonight, as in the audience, Yale Jones, whose firm sent me 12 people to interview last year, who were all involved in a mass shooting at a UPS hub in San Francisco. That's the kind of work that I do. I founded the Center for Occupational Psychiatry in San Francisco, and then it's now in Oakland. And Eric Morgenthau has been the psychologist that I've collaborated with for 37 years. I couldn't do none of this without Wendy Lemberg, who's been my office manager for almost 2 decades. With respect to the book, it's been a labor of love. Anne Hillerman has been a peach. She wrote the foreword, and she herself is a best-selling author. And if you ever read her books, they are of the same genre as her father, Tony Hillerman, who started the series that takes place involving Native American police and law enforcement officers in the Southwest. Her current book, which you might be very interested in, is called Sacred Bridge. So there's a couple other attendees I'll just mention. Dr. Bob Riesfeld went to UCSF and was a resident with me, and Dr. Sarah Poflier was a resident and a fellow that was a trainee of mine and came to work in my office. So welcome to you all. After 33 years, I'm no longer a member of the clinical faculty, but have fond feelings about my experiences working with the trainees, the doctors, and the staff. Let's not forget them. The janitors are important. I'm now, since publishing the book, been giving talks, presentations, appearances, Zooms, whatever, in person now again, to clinical faculty, university settings, schools of public health, professional associations, library audiences. 3 messages I get across, and I hope that you'll hear them. Do no harm, walk in your neighbor's moccasins for a day before you try and change their life, and selectively advocate. I'll just mention one last thing. There is a book club at UCSF, and I hope that some of you are aware of it. And if you are, maybe you'll put in a good word to get wounded workers on as a selected work, perhaps for 2023. Okay, I'm going to see if I can be an old dog that's learning new tricks and share the slides that I have for you, which accompany each of these tales. There's just snippets of the tales. Why I call them tales is that you don't think everything people tell me is true, do you? So the first one is from I Am Unlovable, and I'm going to try and share the screen with that. These are all my photos. That's one of my avocations. So we'll begin with this. This is a story of a woman I call Miss Pham. She was an immigrant to this country from Vietnam, had to learn to speak English, graduated from with honors, and went on to a University of California campus where she met her husband and got a degree in food sciences. I saw her after she was working at a meat processing plant in California, where her hand got caught in a high-speed meat grinder or centrifuge. The accident went on for quite some time. She was locked in there, screaming. The machine was so powerful she could not pull her hand out, and she woke up in a trauma center with a stump instead of an arm. And when she came to see me sometime later, I asked her how she would describe herself, and without looking at me, she said, and she broke my heart, "I am unlovable." My report confirmed the diagnosis of post-traumatic stress disorder. Additional counseling was recommended to address lingering sadness, fears, and embarrassment about her appearance. More importantly, I pointed out that the prosthesis that was in place was unacceptable because it had no functional value and resembled a cartoon appendage. I recommended the resolution of this employee's claims should not occur before there was a viable plan for retraining and workforce reentry. 15 months went by before Ms. Pham and I met again. She had received additional counseling, but resisted taking any medication. A consulting orthopedist agreed with my recommendation for a more functional prosthesis because the one she had was like was rubber and didn't even match her skin color. And that process had been set in motion. Ms. Pham's mood was notably improved. She had given birth to a healthy baby girl, and her husband was about to graduate and begin a job search. She had looked into obtaining training and was going to become a pharmacist. She was receiving the benefits she needed and deserved, follow-up psychological testing, while demonstrating emotional distress no longer caused me to consider the need for inpatient care. The healing process had moved forward, and this formerly hopeless victim now had a future. Ms. Pham had adjusted to the lost limb, future treatment was guaranteed, and her disability claims were settled. My job was done. More importantly, no longer was she unlovable. Okay, I think we're going to go on to another interesting one here. This has to do with UCSF. And so this particular vignette, you'll see this photo. It has to do with the chapter title, which is "We Call You the Hammer." And this is a conversation I had with one of my trainees. And his name is not changed because I don't think it's anything that one would be ashamed of that happened. Dr. Bob, this is the third time we've met to discuss your written work product. And my recommendation to you is the same. Take more time and get me something you'd be proud of. It's a draft. Well, I don't care what you call it. I prefer a report that didn't require me to take 5 hours to edit. I prefer one that didn't expect me to be an English teacher. I prefer that you get me a document that was not filled with misspelled words, incomplete sentences, and run-on paragraphs. Then we'd be able to focus on your case formulation and the pertinent medical legal principles that should be addressed before the final report leaves this office with my signing off on it. I told you, it's a draft. You're not hearing me. You can call it an ishkabibble for all I care. I don't want it. I'm not here to function as a proofreader for you. I expect someone with your level of training to produce a written account describing a person who is in some fashion interesting. You need to get me a story that is like a novella or a newspaper column, okay? If you do your job, then I'll help on quality control so the report can assist others in administering to the claimant's case. For the third time, it's a draft. All right, okay. You brought that up, that number 3 again, okay? I'd like to remind you that this is the third time we've met to discuss your work product, which has been inadequate. I'm a great fan of baseball, and in my assessment, you've had 3 strikes. You don't get to give me another draft, you're out. What are you saying? Good, now you're listening. What I'm saying is that you will not get me another written mess with the expectation that I will fix basic grammar, sentence structure, and spelling. If that were to happen, I won't talk to you about it. I'll instead call up the chairman of our department and tell him to kick you out of this fellowship. Our chair was my professor when I was at your stage of training, and I treated him with respect. I didn't argue with him when he instructed me to improve in some specific way. So I'll also ask him to contact the national boards and make sure you can never sit for the certification exam in psychiatry because you are both arrogant and a menace. That's what would happen if you were to provide me with a fourth draft. I understand. Excellent. So when we meet after your next assignment, we will be able to concentrate on the forensic issues related to the particular case and not be distracted. Well, I never had another problem with Dr. O'Brien. We both knew he could do the work. I learned from my office manager that he left our offices crying following the discussion about drafts. I recall thinking that that was a hopeful response. Teaching can be tough love, but if you take it seriously, it's not for sissies. Several years later, Dr. O'Brien approached me at a professional meeting. I was still a professor at UC, and he was a board certified forensic psychiatrist. Dr. O'Brien, Dr. Larsen, how are you? Good, and you? I'm fine. Do you have a minute? Sure, what's up? Do you remember we had a discussion about my writing style some time ago? Yes, while thinking, okay, here it comes. No one ever did for me what you did. No one ever called me out on the quality of my work or my attitude. As a result of what and how you got through to me, I'm now respected. You're welcome. That was the last time the two of us talked. He died not long thereafter at an all too early age. But before he died, he taught me a valuable lesson. Be confident enough in your own value to accept deserved critical input from others. Reflect on what you can do to avoid repeating bad behavior. Show gratitude to those who help us to be better people. All right. Now we're going to go back and pick up on a tale of an injured worker, move away from the teaching stuff. And this comes from the chapter, We Have a Problem with Guns. Okay. Now, this is a story about Amir. He's an Afghan immigrant. As you can tell, I have an affinity for immigrants, like my mother having been one, like Miss Fan, and like Amir. He came from Afghanistan, and he ended up being an Oakland police officer who was highly respected. I can think for myself many times that OPD officers at Highland Hospital, where I worked in the emergency room, came between me and somebody who wanted to harm me for no good reason. So, a woman had filed a complaint with the police alleging that her boyfriend had brutally raped and beaten her. A medical exam and rape kit were conducted. A preliminary investigation concluded that there was probable cause to arrest the boyfriend. Amir arrived down the street from where the suspect was known to reside. Another officer was in a separate vehicle at the other end of the block. A young adult male ran back into a residence next to the suspects. Seconds later, the suspect emerged from his home armed with an AK-47 assault rifle. He got off a volley of fire, having been alerted to the officer's presence. Amir, with gun drawn, took a round in his hip. The suspect proceeded to light up the squad cars. While a call went out for backup from other police units in the area, Amir crawled to the side of the building, away from where the suspect had been shooting. It was dark, yet in the dim light, Amir soon saw the suspect burst out of a side door yelling, and there's some nasty words in here, but this is his language. "Come kill me, you motherfuckers." He still had the AK-47. If he saw the officer, it would be all over for Amir. The officer lay bleeding on the pavement, and he took aim. Later, he recalled thinking at the time, "Is this a justifiable shot?" Then he fired 4 times, hitting his target with 3 rounds that ended the alleged rapist's life. Amir and I met the next year. He had been taken to the local trauma center where he underwent surgery for the gunshot that fractured his hip, tore through tissue and blood vessels, and damaged nerves. While he still presented as a muscular man in his early 40s, there was a noticeable limp due to a permanent foot drop. He was also left with chronic pain in the low back, hip, and leg. His career was over, and he knew vigorous activities such as running would never be possible. During many of his days and nights while recovering from his physical injuries, he relived the shootout. Amir was grateful for the support of his department. He also had a loving family who was grateful he had made it. He accepted that his life had changed irreparably. He had no guilt about the outcome. He didn't regret having pursued law enforcement as a career. He realized he could benefit from more counseling, but he felt he'd be better off not revisiting the incident. When we met, he was considering his options for alternative employment, as he was determined to be productive and a model for his children. More than ever, Amir had a sense of pride as an immigrant who had been of service to his new homeland. There are so many stories like Amir's, stories of careers ended, stories of lives lost, stories of victims surviving only to live with scars and disabilities, forever reminding them of the event that changed their lives. It is those stories that should cause persons of goodwill to speak out and stand up to the notion that our country's Second Amendment allows for the unfettered right to weaponry that is meant for the battlefield. Hopefully someday things will change. Enough is enough. Now, many people don't think of psychiatrists making house calls, but some of us do. And this particular tale is one that dates back quite a while, and it's in the chapter called House Calls. I was a medical student from Northwestern, taking a rotation at the University of New Mexico in Albuquerque. And on one occasion, I visited a home of a Native American, Pueblo Indian, who lived in the north side of Albuquerque near the Rio Grande. And I call him Johnny. Johnny told us he didn't like to travel to the medical center or even to a clinic close to his home. We were visiting him to make sure he was taking his medication. We also were interested in seeing how he was taking care of himself. I recall that he was in a pleasant mood. He had received notice that his application for Social Security disability benefits had been approved, which meant he would no longer have to depend on assistance from his family. He showed us his pill bottles containing an antipsychotic and a mood stabilizer. He took them twice a day, as instructed, and he no longer needed antabuse to maintain sobriety. Over the past week, he had attended 3 12-step meetings. He denied hearing voices or having evil thoughts. I had never been to a house with dirt floors. While there was some order to it, it was dusty. The windows needed cleaning. The living quarters weren't my style, but things seemed orderly. Indian baskets hung on a wall, and a bookcase held clay pots typical of those fashioned at his pueblo. He had a pot of beans cooking in the kitchen. It smelled good. I was feeling comfortable with our visit when Johnny interrupted my professor and said, "You might want to tell the boy there's a snake under his chair." I saw the doctor look toward me and become silent. I was aware at times Johnny had been delusional. He also had a reputation as a jokester, according to his chart. That didn't make him a liar. Rather than show disdain for his warning by sliding my feet under my chair, I bent over to peek. To my surprise, a large Western diamondback was coiled there and gazing at me. Its good-sized rattle was silent. Using the arms of the chair, I levitated, with my feet coming to rest on the seating surface of the chair. Johnny stood up, went outside, and returned with a shovel. He walked straight at me and bent down to scoop up the rattler. After turning toward the doorway, he passed my professor, who remained silent. He tossed the snake into the yard. I've been trying to get that fellow all morning. The session ended within minutes, and I have no memory of what else took place. That visit to Johnny's was certainly unlike any consultation that might take place back home in Chicago. And then I'm going to try and squeeze one last one in here. And this one is, again, of an unfortunate individual who has been assaulted at work. And it's entitled Raped with a Gun. Not exactly bedtime reading. So This is a story of a woman that I call Janet. She was a Hispanic woman in her 40s who was working at a convenience store at night to have enough money to pay for her family law attorney. The local police had made recommendations of improving safety to this particular store owner. Nothing had been done, including don't have women work alone at night. Toward the end of her shift, a man came in, locked the door behind him, and proceeded to rob Janet. She had followed instructions and had very little money left in the till. She took him in the back room where she had her purse, and he could not get an erection, so he raped her with his gun for 2 hours. Janet had been sent to another colleague of mine who had made a recommendation that while she had PTSD, she was not a perfect person before this. She'd been married and divorced 3 times, like that had anything to do with anything. In my report, I rebutted Dr. Williams' assessment by stating that no one could possibly know what Janet had gone through or might need to recover. The other psychiatrists had made the case for Janet having had problems in her personal life that were not the insurer's responsibility. With that reasoning, a limited course of treatment could be viewed as adequate. I suggested that Dr. Williams was likely healthier psychologically than Janet had been, though that is debatable. I went on to state that if in a hypothetical construct, it was the psychiatrist who had been sodomized with a gun, he would probably want and need more than 3 sessions of treatment. Certainly Janet would also need more than 3 sessions. I made it apparent that I was not sure what the correct number of sessions should be, but I was certain it wasn't 3. If the options were to authorize 3 sessions or none, I recommended that Janet be given nothing. At least that would be honest. Giving her 3 sessions with a psychologist would be akin to allowing a surgeon to perform back surgery, but not close up the wound. After 3 sessions, Janet would be told treatment was over and that she was on her own. Better to give her the message that she had survived and no one cared. Sometimes we must be blunt to make a difference in people's lives. My report was admitted into evidence along with the report of Dr. Williams. At trial, the judge found in favor of Janet receiving outpatient mental health services for as long as the treating clinicians could justify, which turned out to be much more than 3 sessions. The judge had found my reasoning persuasive. Some months went by and the case was brought to my attention once again by Dr. Williams at a professional meeting we both attended. The insurer had sent him my report and asked him to comment on my findings. I bet you found my report uncomfortable about the part of it being sodomized, to which he replied he had. Dr. Williams also admitted that he had gotten the necessary treatment wrong. He thanked me for fixing things. He did not rebut my findings, and upon further reflection, reversed his recommendation that only a brief course of therapy was warranted. The end result was that a horrible event that had changed someone's life resulted in a court order for adequate treatment. I had helped those involved in Janet's case feel a bit of her pain by using my colleague as a foil. I personally provided no treatment in this case, but I made sure that a reasonable amount of care would be guaranteed. So those are the tales that we will have been exposed to tonight. I hope you get an idea of what that is all like, and I will cut out and be willing to take questions. So maybe Anne can help with that.
Sure. I would be hold on, let me get my video going here. All right. Thank you, Dr. Bob. Thank you for those stories. And thank you for mentioning my books. I mean, this evening is about you, but I really, really appreciate it. And since you brought up the idea of law enforcement, we have a question. This is from a person who's especially interested in issues, EMTs, paramedics, and the police. And this questioner is wondering if you have any ideas on things that could be done to help people in these fields with their stress.
Well, that's a great question. I grew up in Chicago where I didn't have a great affinity for the police as a young man. And then later on, as a doctor working in the emergency room in Oakland, I can't tell you the number of times that a sheriff's deputy or a police officer would jump between me and some guy that was trying to assault me for no good reason. And the officer typically didn't know who I was. That was his or her job. So I gained a lot more respect, especially when I started hearing the kind of cases that would come through, like Amir's and others like him. The proceeds from my book at this point are going to the First Responders Support Network. In Northern California, they have a retreat. It's the West Coast Post-Trauma Retreat. And I have referred a number of paramedics, dispatchers, law enforcement officers, firefighters, EMTs. And I think quite highly. They use clergy, clinicians, and peer support, like a self-help group, to help people come to terms with their demons. So I think highly of that, and I believe that that kind of intervention is particularly helpful with first responders.
Thank you for that answer. Here is a related question. What ideas do you have for preventing psychological trauma in the workforce?
Well, that's another good one. Preventing. Some things are difficult, like natural disasters or car accidents. Training helps, and safety measures help. Many of the disasters I see are situations where things could have been prevented, like the case of Miss Pham. She didn't have to lose an arm. And I've seen others like that. When I was getting interested in the field of occupational medicine, I toured the police academy in San Francisco to see what they go through, because I realized in my own training, I had changed. I got more used to seeing blood. I got more used to hearing people tell me terrible stories, including about suicide and assaults and such. So I think training makes a big difference. And then, of course, there's some things. I was raised right. Not everybody is. And you can't easily make up for that. But training does help, I believe. And employers that invest in good training for their employees probably have fewer of these accidents.
You know, this is a wonderful audience. Some of these questions are really very thoughtful. For instance, this question asking if you've done anything to help with workers' comp claims or to help with the legislative process that ultimately would protect injured workers. And I know that besides your work as a doctor, you also are interested in the whole political system. So I thought you might kind of enjoy answering this question.
Yeah, I'm one of those people that does get involved. I mentioned Carl earlier, and Yale as an attorney representing employees. It's not just the individual that you have to look out for, it's groups of people. And I, on more than one occasion, testified before the legislature in California, doing what I could to preserve cases of people who were injured mentally and maybe did not have a physical injury. There was no assault. The first chapter in my book is entitled "Because That's Where the Money Is." And it's about a bank teller who's robbed 4 times. And the last bank robber puts a gun to her head, pulls the trigger and says, "No one calls me ma'am, bitch." And the gun goes click. And it's all recorded. And she never worked again. And I worked with her for a couple of years to get her to be comfortable such that she was not afraid of all strangers and didn't mistrust everybody. She had good training, but I think some things are beyond what we can actually expect. And when a white woman, as opposed to a dark-skinned man, robbed her, it made no sense to her, and the whole world seemed unsafe. here in New Mexico, I've supported gun safety measures, and I've testified at what we call the Roundhouse, our legislative chamber. And 3 years ago, we passed a bill. It's called an ERPO law, extreme risk protection order, or red flag law. So if you have a young man in your family and he's acting bizarre and you know that he's got guns, you can have a judicial hearing, and a judge will listen to the evidence and decide whether he should be allowed to have a gun or not. I think those kind of things make a difference. And so that goes beyond just seeing patients.
Speaking of guns, oops. Can you hear me? Yeah. Speaking of guns, here is a question related to guns. It says, is there some psychiatric mechanism which may explain the persistent advocacy of unlimited gun rights couched in a constitutional envelope, but seem unreasonable to me given the massive gun violence epidemic in this question? That's a question from Dr. Fred Jacobs.
Well, Fred, you and I see things alike, but others don't. I have neighbors that have gun collections. We have more guns in this country than we have people, but most people don't own guns. Those who do don't own one or two. They oftentimes own 10 or 15. And it's also the kind of guns that they own. Now, an AK-47 is illegal. Senator Feinstein, who I first met when I was a young doctor, and she had become mayor after the assassination of Mayor Moscone. When she became a senator, and I supported her in that run for office, she helped to write a bill that became law, and assault rifles were illegal in our country to be newly purchased. And that expired after 10 years. So we have taken steps to limit the access to some types of weapons, and I think also to some people who should maybe not have weapons. One of the bills that I supported at the same time we got the ERPO law through was a proposal that could have become law that said that if you were guilty of felony level domestic violence, you beat your girlfriend, you put your wife in a hospital, and you were convicted, that you gave up not only the right to vote, but you gave up the right to own a gun. We couldn't get that bill through. I was astounded. There was a man who was speaking for the other side, and I find some of these people a little scary. I was grateful that that was the first year where you were not allowed to carry a loaded firearm into the legislative chambers. And the people on the other side were very outraged that they couldn't have their guns with them. But there was one man who got up and spoke for gun rights, and he said, "They're just trying to take my guns away." And the legislator said, "Sir, this is not meant to affect you. You're a law-abiding citizen, I would think, and this doesn't apply to you. You would have to have done something terrible to your domestic partner, a family member, as such." He said, no, you're talking about me." So this was a man who had been convicted of domestic violence, and he thought he could still have a right to a gun. I think, personally, especially as a psychiatrist, if you've shown that you have a history of violence, you shouldn't have a gun. So that's that. Thanks, Fred.
Here is another question from tonight's audience. Many of the cases that you dealt with are really horrific. How do you manage to keep your own equilibrium?
Well,
and I think probably what your answer to this would be of value to other practitioners who are dealing with these same kind of horrendous things.
Well, getting exercise, taking care of yourself, that kind of stuff certainly helps. I think having avocations. I like to dig in the garden. My wife's a master gardener, and I get pleasure out of seeing things grow. Getting away from things and taking trips and treating yourself, that's good. My advocacy, I think, makes me feel like I'm not impotent, and I'm doing something. I'm trying to do something anyway. Tomorrow night, we'll be going to the Four Seasons here, and I will be playing with a local musician, and I'll be having fun with him. So you can take the boy out of Chicago, you can't take the Chicago out of the boy. So that's my answer to that.
Now, changing the subject just a little, what was it that prompted you to write this book?
Dr. Goldstein recognized that I liked to write, and he supported that, and he encouraged it. Interestingly, Dr. Goldstein, as a young man, he had grown up the son of a single mother in New York City. He was the non-commissioned officer in World War II, whose platoon went into the first concentration camp in Western Germany. Everybody was dead. Everybody that could be shipped out, including the soldiers, if you call them that, and the local townspeople had left. And the team that Lester was in charge of had no idea what they were getting into. Lester was a Jew, and that affected him tremendously. During the time that I was his employee and student, I think he was more proud of letters that he wrote in opposition to the Vietnam War than he was of the grants that he got or the publications he had in professional journals. After finding this out, after reconnecting with Dr. Goldstein, I kind of understood better how he was such a curmudgeon. I thought he was a little tough with me, but I probably needed that. I think that's as close as I can. He really helped me with writing. And then when I got into medical school, I'd already been writing papers with others in scientific journals. And so he had lots of citations, things of that sort. But I wanted to get more into policy and talking about things that affected people's lives. And I was involved in running a self-help group for women with cancer. And they at Northwestern, and they taught me a lot about how they could help each other more than sometimes the doctors could help them. Information was important. And so I started writing more, and then eventually I knew I had all these stories, thousands, and I started, with the help of my office manager, to organize them and put them into a book. As I said, it's like building a barbecue with no instructions. I thought that because I had written chapters for textbooks, that I had written papers for journals, and I co-edited a book that was a professional book, that, you know, it's like you do a kitchen remodel and you think you can build a house. But what I found is I had to build a team to help me to do this. And I made a number of mistakes along the way, but the book itself is not a mistake. I made mistakes applying for the copyright, which is very technical and you have to know what you're doing, and things of that sort. But it's done now. And my wife says if I can get an agent and a real publisher, that maybe she'll let me publish the second book, which is tentatively entitled America's Most Dangerous Jobs. And it'll be more tales from a working man's shrink. So that's my answer.
I love your comparison of writing a book to building a barbecue grill without instructions. I think one difference is, though, when you're writing a book, there's really no danger of blowing yourself up or setting yourself on fire.
I think my wife at times thought about blowing me up.
What were reactions have you had to this book? It's been out now a little more than a year. Are you hearing from readers and other doctors? Do people seem to resonate with these stories?
Well, that's a good question. I think some of the people that are portrayed in the book have responded positively. There's patients that I've had who are grateful that somebody has heard their tale. Many people find it difficult, but if they get the purpose of the book and of my career, it's that you take a person who's been victimized and you help to give them the opportunity to be a victor or at least a survivor. And that does a tremendous amount. I mean, that story of Miss Pham is a real story. She went from being unlovable to having a future. And many readers, they pick up on that and they realize it's not bedtime reading. It's not like a holiday book. You wouldn't give it to kids because there's a lot of swearing and violence. But there are tales of redemption in there as well. And so I had a doctor recently tell me, though, that he bought the book and he could only read the first few chapters because he found it too depressing. And I said, okay, maybe I just have a different take on it, because I don't think most of the tales that are told are intended to leave you feeling like no change has happened and all we're doing is recounting people's misery. I think that instead you see that people with the right assistance and encouragement, they can make lemonade out of lemons.
Were you ever surprised at the resilience of some of the people that you dealt with?
Oh my God. I had a man come into my office. He had been a respiratory therapist and he had given treatment to someone with a fulminating infection. A few days later, he was on a fishing trip and he called his wife, who was a nurse, and he said, I feel terrible. I don't have a thermometer, but I'm pretty sure I have a horrific fever. And I just feel, she says, you have to get to an emergency room. She was a nurse. And he did, and he ended up at John Muir Hospital in Contra Costa County. He was transferred to UCSF, where all 4 of his limbs were amputated. And he underwent 3 reconstructive surgeries to his face. 12 years after this happened, the insurance company responsible for his case sent him to me because his wife had said to him, baby, I love you, but our marriage is not going to survive. You have to get off all of these painkillers, because he had a lot of stump pain. His arms were amputated just past the elbows, legs just past the knees. And the insurance company wanted to know whether they should be responsible for his drug rehab. He came into my office with no shame, held out his titanium arm and shook hands. He wore long pants so he wasn't showing off his titanium legs. And he was matter of fact about his situation. Well, not only did I end up recommending that the insurance company pay for the drug rehab, I called the nurse up who had made the referral. And I said, you're going to have to pay for this. Oh, yes, we thought so, doctor, but we just wanted to make sure that you had agreed with that. I said, I'm not done. She says, what? I said, that bad infection eventually wore out his aortic valve. I looked through the medical records. He needs a valve replacement. She says, you're just a psychiatrist. I said, yeah, with a degree in cell biology, who taught microbiology to my fellow medical students. And I've studied infectious disease, and that bacteria is responsible for his valve giving out. So send him to a good surgeon or infectious disease expert, they'll tell you the same thing. She says, okay, doctor. I said, I'm still not done. To do the valve, you're going to have to do coronary bypass surgery. She said, well, that's familial. She knew his case. And I said, yes, but if your company is responsible for doing the valve, you have to do the bypass surgery first. That was about $1 million worth of treatment that I was recommending as a psychiatrist. Now, you know how many referrals I got from that insurance company after that case, but I sleep well at night.
There are a lot of questions about people who are thinking they would like to be writers, or they are already writers, wondering what kind of advice you would have for them about working on a book.
Well, you have to have a passion. You have to have some kind of vision of what you want to produce. It helps to have some people that can give you advice and mentor you, like you have done with me. And it helps to have a great editor. If you can put together query letters and get an agent, great. It's not that easy, I find, when you're writing nonfiction as a first-time author. And you have to be in it for the long haul. I mean, you don't just write it and it gets done. You go through multiple drafts, and then there's the design work that has to come into play, and all the other practical things about not just publishing the book, but promoting the book. And how are you going to do that? And do you have the time and the commitment to do that? And if you have a family, can they handle it? Or, is this too much of an imposition on them? So, if you have a burning passion, I'd say go for it. We need writers. My parents love to read, and they instill that in both of their sons. My wife and I try to encourage young kids to read. And so we buy books. Back in San Francisco, we bought books for kids at Glide Memorial, the Methodist church, at Christmas time. And people said, why don't you give them toys? I said, well, I'm selfish. I think if you get a young child to learn to love to read, they're more likely to go to college than prison. And then they can pay for my Social Security. And we've given books to local Indian families, and even some up in the North Dakotas. I think instilling the love of reading is an important thing. So if you want to write and you like writing, go for it.
Was there any, as you were working on the book, were there any surprises, any things you thought, oh gosh, I didn't realize this, or this is more fun than I thought, or more work than I thought? How was the process for you?
It's a labor of love. And at times, I was learning things along the way, and I assumed they would be a lot simpler than they were. I'm not a technology genius, and so probably that created some problem there. I was also used to working, when I did my professional publications, with a professional editor and publisher, and they made a lot of this seamless for me. When I was publishing my first book and creating my own publishing house, there were boo-boos that happened, and but I'm proud of the book now. But it didn't just happen. It was like 2 to 3 years of work to get it to come to where it is now. And still, we published initially the paperback, then the ebook, and they're on Amazon. If you want to buy the books, you can get them on Amazon, and let me know, and I will get you a personalized book plate. And if you get I know it's about time, the paperback, I got bookmarks for you. And I will be having the hardcover, which has the award from the Nonfiction Authors Association on the cover. That's available, but you have to contact me at this point. It's not on Amazon. And the paperback is about $17. The Kindle's about half. The hardcover, you send me a check or for $30. You can have my contact information. Well, you can. It's work. workingmanshrink.com. And you let me know.
I'm noticing, excuse me for interrupting you, but I'm noticing that the alumni relations group is also putting up the links. So that'll save people from thinking they have to remember it.
And the proceeds will go to a good cause. And I just like to mention the last chapter of the book is called Giving Back. And it's got quotes from all these famous people in the world, like Denzel Washington and Dr. Seuss and Mahatma Gandhi, about giving back and how important it is, and Muhammad Ali. And I ended up with a quote that I think is maybe a good place to stop. In the end, we are not defined by the particular product or service we create, but rather the manner in which we affect those we serve. If you are engaging in meaningful work, those for whom you provide service will define your value. So I'll leave you with that.
That's lovely. That's lovely. I have enjoyed our conversation so much. Thank you for doing this tonight. Thank you for inviting me to be with you. And thanks to everyone in the UCSF audience